Is ibuprofen more effective than paracetamol in the treatment of pediatric fever? In this video, I'll be going through how I gained the answer to this question through research and reflecting on the experience. The first step in researching a question is formulating a PICO question. The question I'll be researching is already in a PICO format involving the 4 key elements: population, intervention or issue, comparison, and outcome. In this question, the key terms are pediatric, fever, ibuprofen, paracetamol, and treatment. To get a broader array of results, it is important to use alternative words when searching. This allows for the inclusion of other relevant sources that use synonyms or similar words to that in the original PICO question. In this case, I've used infant, children, and adolescents, and temperature, febrile, and pyrexia for alternative population words, Nurofen and Advil for intervention, Panadol and acetaminophen for comparison, and intervention or therapy for outcomes. The use of these words increased my search result because now I have searched the database for articles using different terms for pediatrics as well as the drugs included in the question and outcomes expected. To search the databases for the answer to this question, you must go onto the UAW library and then to Advanced Search. Then clicking A to Z databases and going onto Sinal. I have chosen to use Sinal and Medline for my research as they are databases with hundreds of nursing resources. Once onto Sinal, clicking Choose Databases and also selecting Medline. By doing this, it allows you to search both Sinal and Medline at the same time. Once that is done, I put in my keywords and alternate words in search boxes. As you can see on the screen, I put pediatric, infant, child, children, and adolescent into the first box, followed by ibuprofen and Nurofen in the second, and in the third I put paracetamol and acetaminophen. Finally, in the fourth box I put treatment, intervention, and therapy. The additional limiters I set in place help narrow down the search to the most recent and most relevant articles of information available. Limiters I set include the date range from 2018 onwards, changing the source type to academic journals. This limits the appearance of magazines and other forms in the result, and adding major headings to include ibuprofen and acetaminophen and fever. I also added an age range of infants from 1 to 23 months and preschool age children who are 2 to 5 years old. These limiters sorted through the results, minimizing excessive amounts of articles, which leaves me with 10 relevant articles. As you can see on the screen, the top article under this search is Comparison of acetaminophen with ibuprofen for treatment of fever or pain in children younger than 2 years. This article is a systematic review as well as meta-analysis. This is the highest level of evidence available. A brief summary of this article includes systematic reviews of databases such as Medline, Sinal, Embase, and Cochrane. They used keywords such as paracetamol, acetaminophen, ibuprofen, neonate, newborn, infant, toddler, and pediatric, with variation. This study included all published studies from any healthcare setting that compared the short-term and long-term use of the medications. A primary outcome of this study was the moderate quality evidence from randomized studies showing that ibuprofen compared to acetaminophen was associated with reduced temperature within 4 hours, but that the superiority of ibuprofen did not continue after 24 hours after the treatment onset. This paper also shows that several authors have cautioned against the use of ibuprofen in those infants aged 3 to 6 months due to safety concerns. The most common reason for this is the higher perceived risk of toxic kidney effects. However, there was no evidence to support this. The study concludes that large randomized trials are needed to build upon knowledge designed to include the subgroup of those younger than 6 months to investigate the safety and effects of ibuprofen and acetaminophen on those specific age groups. This study is of greater significance as it involves a much larger group of research participants, including 11 studies involving 28,450 participants. whereas another search result titled Ibuprofen versus Paracetamol for Treating Fever in Preschool Children in Nigeria only included 140 participants, and it is a randomized control trial. This means that the publication is at a lower level of evidence than the systematic review and meta-analysis summarized previously. A factor to also consider is the amount of participants in each study. Those in the first publication mentioned were from many different places around the world, such as the United States, France, the Netherlands, Israel, Turkey, and Iran, whereas those in the Nigerian study were solely based in Nigeria. The systematic review is also a filtered source, making it more reliable than the unfiltered Nigerian source. This is because filtered sources appraise the level of study and filter current knowledge. Completing this task has allowed me to expand my knowledge on the topic as well as research and the research process. I'll be reflecting on this experience using the Gibbs reflective model. I'll include how evidence-based practice improves patient outcome and nursing practices. The first stage in this model is description. During this assessment task, I was tasked with choosing a topic from a set list and was required to research and provide a brief summary of my findings as well as show my research process and how I got my results. The question I decided to research was, is ibuprofen more effective than paracetamol in treating pediatric fever? Initially, I was set on doing a different question, but decided to change to this one after doing some research for that question. Finding the highest level of evidence available for the question was also required to ensure the source was useful and reliable. In this assessment task, I have compared the systematic review I've located with a randomized control trial, also on my research list. This supports the fact that my chosen publication is the highest level of evidence available. Following the second stage of the model, I'll be reflecting on my feelings throughout the process. Upon starting this assignment, I was feeling pressure to choose a question that I was interested in and pressure to find alternative words for the key terms. However, after attending the support session and reviewing the criteria, I found clarity and became confident in my ability to research correctly. I'm happy to admit that I was a little bit nervous coming into this assessment, since this is the first subject I have learnt how to properly research before. The databases Cynol and Medline through the UAW library was seeming pretty overwhelming at the start. Luckily, the tutorial tutor, Chris, was very helpful during our class time, staying back at the end to answer a few questions that everyone had. This put me at ease and gave me confidence in my ability again. The good, the bad, and the in-between of this experience. Personally, I found this assessment very challenging in the start. Initially, I was not confident in my ability, as this was my first subject that I had learned how to research correctly and utilize evidence-based practice. Completing the research for this assessment allowed me to put theory into practice from my Moodle work and therefore growing my confidence as a registered nurse. Resources that aided me to get this outcome were the UAW library and the tutorials for snug202 I have attended this semester so far. Next time I'm required to research a topic, I will aim to include more specific limiters to gain an even more refined search result. If I was tasked with researching a question in the future, I would be very confident in my ability to find the most relevant sources, as well as being able to distinguish the highest level of evidence. I've discovered how to accurately search for publications on Medline and Cynol at the same time, as well as placing limiters on search results to gain a more refined and relevant result. Ultimately, the publication I have chosen is Ibuprofen is more effective than paracetamol in the treatment of pediatric fever is the highest available level of evidence, as it is a systematic review and meta-analysis. I have included a comparison article to support this. Applying the limiters and creating the correct alternative words aided in my search and created a smaller search result with more specific articles that were relevant and reliable. By sourcing and applying the highest level of evidence, we as nurses are improving patient outcomes.